Today's topic is senescent cells, right? The actual topic is senolytics. A senolytic is something that kills senescent cells. But before that, we have to understand what senescent cells are. We have not been taught this in our medical education. This is, and let us start it.
Some cells don't die when they should. They stop dividing, they stop repairing, but they refuse to leave. These are called senescent cells, zombie cells of the human body. They form when cells are damaged by age, stress, DNA errors, or inflammation. To prevent cancer, the body shuts their division down, but instead of dying, they stay alive. And that's where the danger begins. Senescent cells release toxic chemical signals, inflammatory proteins, enzymes, and cytokines. This is called the senescence-associated secretory phenotype. In simple words, they poison their surroundings. Nearby healthy cells receive these signals and slow their own regeneration. Stem cells stop repairing tissue. Inflammation spreads. Silently, one senescent cell can turn many others senescent. This creates a chain reaction of aging. Muscles weaken, skin thins, organs lose flexibility, healing slows. Even worse, the immune system becomes less efficient at removing these cells with age. So they accumulate. Aging is not just damage. It is damage that refuses to leave. Your body doesn't fail because cells die too fast. It fails because some cells stay alive for too long. Youth is not about keeping cells alive forever. Youth is about knowing when to let them go.
We'll be talking about senolytics and how senolytics can make exosomes. You can get exosomes from outside, but what do exosomes do? How do they work? We'll talk about all of them. Today we'll be talking about senolytics and in situ exosomes. Now, I believe almost all of you have heard about exosomes, and many of you have heard about senolytics. But most of the time, you have not heard about in situ exosomes, a way of regenerating hair biology from within. So, this is a series where we talk about 10,000 grafts, where surgery should become a cellular music. And sorry, I forgot. I'm Dr. Captain Arvind Poswal, and I will be starting this webinar now. Let us go step by step. So, senolytics and in situ exosomes. We have to understand these terms. As doctors, we are not taught about them. We have to understand why clearing senescent cells matters more than injecting exosomes alone. The key message here is that the best exosomes are the one made by your own body. True regeneration begins by restoring the cellular environment. We have to restore the environment, not just add external signals in form of injections. A lot of people have attended all the webinars, but for those who have not attended, I'll just go over the series so it can help you maintain continuity. In the first webinar, we spoke about how surgery becomes biology. When we are doing mega sessions, 10,000 grafts, it is not just surgical techniques. You have to understand that it is a biological event, and you are the master orchestra organizer who has to manage that event. So that is what we spoke about in webinar 1. In webinar 2, we spoke about the evolution of mega sessions through biological respect, aligning biology with our surgery. Hair transplant is one of the longest surgery known to human beings, sometimes lasting over 2 to 3 days. I have done surgeries over 7 days in patients. So in that time, you have to have a biological respect for the body. You can't just do something which you do for a 1 day procedure on a 3 or a 2 or a 7 day procedure. So that was what webinar 2 was about. Webinar 3 was about the new NAD precursors and AI agents and how they are required and they should be used in mega session surgeries. Doctors used to put 50 grafts, 50 plugs, and then they should used to think that they are tired. When I started, the maximum number of grafts doctors in the world could put was 3,000 grafts. Now, 8 to 10,000 grafts is a norm. 5,000 graft is something which everyone does. But we have to understand that the grafts need energy. That is where NAD precursors come in. If you are not giving your grafts energy in form of NAD, then what is the point of it? So that was webinar 3. In webinar 4, that is this, we'll be talking about cellular aging. The grafts come out, they start aging. We'll talk about senescence and we'll talk about regenerative signaling in form of exosomes. The core thesis here, or the core principle here, what we are talking about is that when we are doing hair transplant, we have to factor that hair loss, poor graft survival, slow healing. They all play an important role and they all share a common root. That is cellular senescence and inflammatory overload. Regeneration requires removal of those biological breaks. When I say breaks, those are the senescent cells. The underlying principle here is that you cannot regenerate tissue without first clearing the senescent cells. If the environment is not good, and if a person has a fever of 104-degree centigrade and you give him vitamin B12 and vitamin D to make him healthy, that will not work. Same is the thing here. You cannot regenerate a tissue without first clearing the senescent cells. So what are these senescent cells? We saw in the video before the presentation, but I'll say again the definition. These are aged, non-dividing cells, cells which became aged before their time, but they are not going to die. They secrete inflammatory signals called SASP, which in turn block stem cell activation. It makes the tissue old and they disrupt tissue repair also. And angiogenesis, not only does the tissue become old, it loses the capacity to repair itself. Why? Because it creates these senescent cells, create a hostile microenvironment for grafts as well as the follicles. So let us understand senescence in hair and scalp because we are talking about hair. I'm not a heart doctor. So senescence is visible in the aging scalp, of course. As people grow old, they have a lot of aged cells, senescent cells. On the right hand side, you can see a AI generated image of a senescent cell secreting all the inflammatory molecules. It is also present, senescence is also present in cases of chronic hair loss, like in telogen effluvium. If you are to take a biopsy, do expensive test to check the
Sorry,
senescent
my
cells, you will
brother's
find a
that
lot more.
webinar has started, so I just okay.
Our 35,000 and
Uh,
there.
is it okay? Should I start now? Senescent
But
cells, important for us hair transplant doctors is that senescent cells are present after any surgical trauma. And us hair transplant doctors are doing all the trauma. We take out 4,000 grafts, we make 4,000 wounds, we put 4,000 grafts, we make 4,000 wounds. That is surgical trauma. Surgical trauma does lead to senescence because you are debilitating the skin tissue of the scalp. The key insight here is that mega sessions, when you are doing 8,000, 10,000 grafts, they will amplify senescence unless you actively address it. So today we'll be talking about how to address that so that you can get good results also. It's not just about the numbers, it's also about the final result. So here we come to senolytics. Now senolytics is what I call removing the brake, the thing which is stopping our stem cells from rejuvenating us, from keeping us young. You remove that brake by removing the senescent cells. Senescent cells are removed by senolytics, as the term is clear, lysis. So senolytics selectively clear senescent cells. As a result, they reduce the inflammatory load because senescent cells were what were making the inflammatory chemicals. And then they restore the responsiveness of the resident stem cells. You don't always need to inject stem cells from outside. If you make your own stem cells young, many a time you see 20-year-old boys who are almost Norwood 5 or 6 when their fathers or grandfathers were not. So what have they done? They have mutilated or debilitated their hair follicle stem cells. So our goal is to reset the regenerative capacity of the tissue. And here the tissue is scalp and the hair follicle stem cell. Now here we come to fisetin. I am telling you the molecule. Take it from anywhere. There is no conflict of interest in this respect. Let me tell you very clearly. Fisetin is a natural senolytic flavonoid found abundantly in strawberries. Eat as many strawberries as you want. Normally, you will have to eat around 200 to 300 strawberries every day for the rest of your life to get the senolytic benefits that you can get from fisetin. But here we are talking about topical fisetin, that is fisetin which you apply, not eat. There are capsules of fisetin also for full body, but right now we are talking about topical fisetin. Why? Because it is a natural senolytic. It has a strong safety profile. It is natural. It clears senescent cells without damaging your healthy cells. It also supports the mitochondrial and anti-inflammatory pathways. So fisetin is not a growth factor. It is a small molecule, and in short, it is a biological reset signal to your cells. So here we talk about senolytics versus growth factors because I see a lot of obsession with growth factor injections. So understand this thing. Growth factors are not bad. They signal regeneration. But you have to understand the tissue. If the tissue is not young, then growth factors will not do too much. So senescent tissue, when you are giving growth factors, if there is senescent tissue, it cannot respond effectively. That is why you find many a times some patients will say they got a lot of good results with PRP, while others will say that they didn't get any result. That is because platelets contain growth factors. If you are leading a unhealthy lifestyle, Your platelets will not contain a lot of growth factors. Improve the lifestyle before you give the PRP. So the truth is that signaling without clearing senescence, you give signal with growth factor without clearing senescence is like shouting at a blocked receiver. Now we come to the most important thing, a question of exosomes. We keep on hearing about them. Exosomes are signaling packets, and these are made by every cell in all human beings, in all animals, in all plants, in all living things. Exosomes are not something exotic. Unfortunately, they have become popular as injectable products, and often they are derived from plant sources, animal sources, marine sources, human sources. Every time, remember, it is the cells of the plants, animals, marine animals, and the humans which are making those exosomes. The most important thing is that they are illegal to use on humans, on patients. Here, I want to clarify one thing. A lot of time, a lot of time, people confuse it with off-label resource. When a drug is used as off-label, that means that drug or that molecule has been researched and approved for use in human beings for at least one condition. That is off-label. Then you use it for another. But exosomes are not allowed, are not permitted, are not approved for use on human beings. When you are using exosomes, it is not an off-label thing. It is an illegal thing. You'll find it written on the injection that this is not for use on humans. It is only for research purposes. This is a very important thing you have to remember. Don't use just anything on your patients. Apart from that, of course, they are extremely expensive. 20,000 to 30,000 for rupees for just one injection. And what will those exosomes do? They will be used up by the stem cells, by the cells in the area, in the tissue. Of course, you will have to keep on injecting again and again. They are not going to stay there for months, not even a single month. So they are definitely short-lived. So the key question here is, since there are so many disadvantages, can we stimulate the body to produce its own exosomes? If fishes can make exosomes, if a rose flower can make exosomes, if you can get exosomes from a rat or a human placenta, of course, our own cells also make exosomes. So let us understand our body, our skin, all our organs makes exosome. All stem cells make exosomes. You just have to give them the right condition. This is where we come to in situ exosome generation. That is exosomes inside the particular tissue. Here important sentence to understand. Healthy activated cells, wherever they are, they naturally release exosomes. A senolytic environment that is free from aging, free from senescent cells. So a senolytic environment enhances endogenous exosome output. The resident stem cells become the source of your exosomes. This is regeneration from within. We do not need imported signaling. If required, it should be imported signaling should be a exception. Now, let us understand topical fisetin. Fisetin is a senolytic, and we are going to talk about topical fisetin as a trigger for hair follicles. Remember, hair is something you can see. You can't see your liver, you can't see your kidney, you can't see your heart. If it is getting old, you have to get tests done. But when you are getting your hair is getting old, it becomes weak, it falls early. So topical fisetin, what does it do when you apply it on your scalp? It clears the senescent cells locally. It reduces the inflammatory noise, the inflammatory overload. How does that inflammatory overload occurs? It occurs by what you eat, what you breathe, the air, the water around you. But the major cause nowadays is what you eat. All the preservatives and all the processing agents, they are the ones which cause the inflammatory noise. And we have to slow that down. As a result, when we apply fisetin, it helps increase the local exosome production in that particular skin tissue, whether it is scalp or face. Many people may ask me, on what basis am I saying all these things? There are many researches. This is just one of them. Please go through it. Exosomes derived from fisetin treated keratinocytes mediate hair growth promotion. This is a landmark research published in 2021. There are many deep, interesting things in this. I'll be talking about that later. So go through this. You can take a picture of this, read it thoroughly. So why in situ exosomes instead of just putting injections? We doctors are very fond of injecting. Why in situ exosomes are superior instead of injections? One, they are autologous. Your body makes them. The tissue makes it for itself. There is no better match. So it is autologous. Second, it is context specific. The once you put the thing, remove the senescent cells, once the exosomes start forming in the tissue, the exosomes are formed for the tissue problem. Whatever is missing, it gives it. So it is context specific. When you take it from an animal or a rose is making exosome for itself. Do you even know whether the cell is stressed or at rest or properly nourished or starved? But when we are doing it on our own body, that is in situ exosomes, they are context specific as well as tissue specific. And there is a very short diffusion distance. You are providing them right near next to the stem cells in the hair roots. And of course, there is no immune mismatch. Your own body is making those exosomes, so there is no risk of any mismatch. As I say, the best exosome is the one your own cells produce. Now we talk about how is it relevant in hair transplant surgery. You see a 20-year-old boy nowadays, 20-year-old, 22-year-old boy who is almost Norwood 5 or Norwood 6. And he says that his father got bald at 35, maybe 40 also. So what is happening there? His scalp is becoming old, increased senescence. So in hair transplant surgery, what we would like is less senescence. You will agree with me on this thing. Let us reduce the bad things. And of course, more exosomes. And if we can get those exosomes without injections and without veils and roses and placentas, all the better. So, less senescence in the tissue and more exosomes leads to better tissue and better growth. So, it helps in both phases, pre-operative scalp preparation also, where you make the skin healthy, you make the donor healthy, provide them with exosomes by just using the derma roller and fisetin. Make the recipient area more receptive. This is in the pre-operative scalp preparation. I'll tell the steps later on. The second is post-operative healing acceleration. Once the grafts are there, why will you not give them autologous exosomes when you can give them so easily by just applying fisetin? Of course. So senolytics are very important because they prepare the field, the recipient area before growth even begins. They help, they strengthen the stem cells in the grafts. They help in angiogenesis in the surrounding recipient area. Now let us understand the synergy with microneedling. Hair transplant is of course one thing, but after hair transplant, you have the hair around that transplanted area which is thinning. You have to save that also. And for that, I advise microneedling, that is using a derma roller or a derma pen, ensuring that there is pinpoint bleeding in the skin tissue where you have almost 100% hair roots. Wherever there is pinpoint bleeding, the body sends platelets. And the patient can do this every week. If you are afraid every week may be too much, do it every 2 weeks. There is no problem. Microneedling creates a controlled micro injury. Platelets reach there. When you apply fisetin on top of it topically, fisetin clears the senescent cells around that injury as a senolytic. And also, it gives stem cell signaling and exosome release is amplified. So you are getting so many things. There is controlled trauma plus senolytics leading to amplification of the regeneration. Now, why this approach is safer than injecting imported or injections of exosomes? First, there are no forced pathways. There is no pathway hijacking. A lot of time when I see hair growing, whether thin or thick, with exosomes, those exosomes are from extraneous sources and they act on WNT and beta catenin pathways. Just remember these terms. Anything which activates the WNT and beta catenin pathway means that the cells can keep on multiplying endlessly. That gives a risk of carcinoma or cancer. That is why exosomes are not yet allowed. Once we reach a stage where they have been researched enough, we can monitor them, make sure that the correct exosomes are there, then definitely use it. But right now, it would be unwise to try to hijack pathways when no one in the world has the experience or the knowledge to use them. You may get good results, but at what cost? True regeneration does not mean that you inject something from outside. Regeneration is part of our body. Our body regenerates itself, our cells regenerates itself. If we correct the biology, regeneration occurs. True regeneration should always respect biology. Let us compare the two strategies, then we'll go to the next step. Extraneous exosomes, that is exosomes in injections, versus in situ exosomes, that is exosomes generated in the skin. So extraneous exosomes have some disadvantages. One is variable quality. You don't know what the rose is making. You don't know what the umbilical cord is making or what the whale or the shark is making. The cells may be stressed, the cells may be starved, the cells may be under attack of toxins, they may be making exosomes to counter that. So the quality is always going to be variable. You never know what you are doing. Second, they are short acting. Exosomes are not something that will remain forever. They are small packets of useful things or useless things which the stem cells need. So they use them up. Once they are gone, then you need to inject again. So that brings us to the important question, money. Of course, they are expensive. One injection or two injection, one injection of exosomes can vary between 20,000 to 40,000 rupees. How long will they last? So definitely, it's an expensive thing, not something the bulk of the population is going to follow. As a result, once you stop the exosomes, even if they are good, everything is good. The patient goes back to square one, something which happened with minoxidil. If you don't explain the patients that you will need to keep on taking them for the rest of the life if you are not going to improve your own exosomes, then it is expensive. And lastly, illegal. They are illegal. They are not off-label use. And if someone were to ever say, we have a sound problem, let me just clear. Can you hear me? Let me see. I'm not unmuted. No, very good. So they are illegal, actually illegal, not off-label. Off-label is something different. No medical authority, no FDA has ever allowed use of any exosomes for any human beings. The companies are selling you and they are clearly labeling it. Tomorrow, if someone goes ahead and tomorrow, if someone asks you, how did you decide to give a injection which is not allowed for human beings to a human, that will be a problem. Now, let us compare that with in situ exosomes. I am not against injections of exosomes. Tomorrow, one time when we are confident about them, when they are standardized, when we are sure what they contain, what those tiny packets of exosomes contains, definitely we can give injections. But let us compare that with in situ exosomes, the exosomes made by your own tissue. First thing, they are physiological. As I said, made by your own tissue, made for your own tissue. If your skin is making, if your scalp is making the exosomes, it knows what the environment around it is. It is making those exosomes in response to that. Second, it is sustained. Just a derma roller or microneedling and a regular application of fisetin or a senolytic ensures that you have sustained exosome formation and it is cost effective. I just told you the cost of exosomes, 20 to 40,000 rupees a injection. Fisetin and derma roller will cost you just about 1,000 rupees, maybe 10 to $15 a month, and the patient can continuously get exosomes in his skin. So definitely it is cost effective. And most importantly, it is safe and no one is going to question you about it. The body's own tissue is making exosomes for itself. It is species specific, not from another species. It is tissue specific. In future, I would, as research goes, I would say it is condition specific also, because the cells will make those tiny packets in response to the environment. So, what is the clinical implications? One is better graft survival. We all want that. You give them the best exosomes, the best growth factors, everything. Faster epithelial recovery, the recipient area recovery, improved long-term follicle health. We have to incorporate these measures in our practice so that it can lead to a long-term follicle health. We keep on seeing younger and younger people getting bald nowadays. We cannot just say that is normal. Children are not bald. Means the hair loss genes were silent when we were born. We activate them unknowingly, maybe. Earlier generation used to activate them at 30s. Children now, their genes of hair loss are activated at 20, 18, maybe 16 also. So we have to improve the follicular health if we want to give meaningful hair coverage for a long term for the current generation. This is for doctors and patients alike. Of course, all these things will reduce fibrosis and inflammation. Now, the important thing, the ethical and the scientific position. As doctors, we have to understand that we have to stand by ethics more than anyone else. And we have to have a scientific position. We are the scientists. Being a scientist does not mean you do a PhD. Being a scientist means you are a doctor, you are looking at things, you are understanding what they are doing, and then you try to improve them. So, the ethical and scientific position, which I would like to say, is that regeneration is not about adding more and more chemicals or molecules alone. It is primarily about first removing those things that are blocking the healing. Here, senolytics are important. They restore the stage. After that, biology performs the play. The underlying philosophy is that you cannot rejuvenate aging tissue by addition alone, by injecting alone. You have to clear senescence, restore the biological signaling, allow biology to regenerate. When senescence is removed, regeneration becomes inevitable. It comes from within. Now, a lot of people will ask, how do we measure senescence? So, here is something which I am presenting, something which you can use from tomorrow itself in your own clinics. That is the biological age calculator. Now, senescence, that is when your cells are getting old. At that time, every time you are not going to take biopsy and measure it. But at that time, if you check the biological age of the patient, a young person comes to you, 20, maybe 25 years of old, and he is massively bald, but his father got bald at 40. The first thing you do is check his biological age. Get a series of blood tests done. I'll give you the blood test also. Just feed in the values. And if he is around, let's say 25, but his biological age comes to 35, that means he is experiencing the same amount of hair loss as he would have experienced at 35 years of age because of senescence. So this is something you can implement right away tomorrow. It is a biological age calculator. It is a AI artificial intelligence program. It is available on my website, and the link is available here. You can take a picture if you want. The website is livenaturalproducts.com, and it is biological age calculator. You just fill in, this is the biological age calculator, what you will see there. You fill in all the values. Make sure that you fill in the correct units. If the units are wrong, you can get a wrong in biological age. Then you calculate the biological age. Show it to the patient. After 3 to 4 months, you can repeat this test. If the biological age comes down, that is a conclusive documentary proof of what you are doing. Excuse me. This AI program, that is biological age calculator, will also give you AI recommendation. You can see that button towards the bottom. Many doctors do not know what supplements are normally required, the newer ones. So you can get there. But I'll still say, understand the supplements. Don't rely on AI recommendations alone. For that, I have regenerative medicine courses also, long-term courses also, and free micro courses also. Take some time, go through them. It will help you. So this is the biological age calculator, which can help us correlate the senescence. The higher the biological age compared to his chronological age, the higher the level of senescence. Once you reduce the senescence, then the biological age is also reduced. But what will you see on top of his head is thicker, better hair. Not just the transplanted hair, his own hair, which he was losing before time. So use this. This is free. There is no payment involved. It is available on my website. It is available for all of you. Just make sure, as I said, the units when you feed in should be correct. If you need any help, do not hesitate to contact me. Now, here I give a short thing about how fisetin helps. A lot of time we hear that, okay, inject exosomes and magic happens. But what do exosomes do? Let us understand that part also. You apply fisetin on your skin, on your scalp, it is absorbed, or maybe you do microneedling for further absorption. Fisetin leads to formation of exosomes. The stem cells make exosomes, the keratinocytes make exosomes. But what do they do? How do they help? How do they work? They increase the TERT level. TERT is telomerase. So what happens in here which are falling or becoming weak? The stem cells become weak. How do they become weak? The telomeres become short in response to a bad lifestyle, pollution, water quality, diet, a whole lot of things. That is how people get a higher biological age also. So at that time, the telomeres at the end of the chromosomes in the stem cells, they become short. But when fisetin is applied and when exosomes are made, as research shows, they make TERT. TERT is telomerase. Telomerase re-lengthens the telomeres. It makes the telomeres safely long again. Longer telomeres means healthy stem cells which can work to their full potential, stem cells which can multiply. Once they multiply, your hair becomes stronger, thicker. They don't fall out. So this is how the entire chain occurs. from physetin to exosomes. Don't stop at exosomes. Go to the next step, that is telomerase, increasing the length of telomeres, and that is what we will be talking about in our next webinar. Repair the telomeres. That is how you rewrite the cellular clock. You can make those hair remain with you for much, much longer. Short telomeres don't heal. Activating telomerase in regenerative medicine and in hair transplant is a way to demonstrate regenerative medicine. As I say, respect biology, that will help you redefine possibility. If you need any products which I have mentioned and you can't find them anywhere, we have a website, livenaturalproducts.com. You can go there. If you need more education and information, we have you can go through my courses. They are paid courses as well as micro courses which are free. Let me know if you have